All right, it is 11:40. My computer just did the little chime thing. So my name is Grace Nagel. I work for the Department of Veterans Affairs in the Safety and Emergency Preparedness Department. I am part of central offices and the agency wellness committee. And I'm here to introduce Leah Rudd, who is here from Aurora Lasik, and she is going to teach us about the refractive surgery options offered and how they can help you get out of contacts and glasses. So we've only got 15 minutes. I'm going to just turn the time on over to Leah right now. Thank you for being here, Leah.
Hi, thank you. So I do have a little bit of a slideshow that I'm just going to pop up and kind of go over with everyone. Let me go ahead and share my screen. Oh, now can everyone see that?
We're seeing, you need to hit the presenter button on the bottom. It's thinking no. Yes.
There we go. Okay. So again, my name is Leah Rudd. I'm one of the patient counselors here at Aurora Lasik. Here's our contact info if you want to know where we're located. We are in Lacey, kind of in the Hawks Prairie area. We share the parking lot with the Harley Davidson dealership, so that's kind of nifty. This is Dr. Rudd. Now, I don't actually have any relation to Dr. Rudd. It was just a happy coincidence there. I'm pretty sure they saw my name come across on the applications and went, we're taking her. But Dr. Rudd has been practicing. He's a corneal specialist, fellowship trained. He has been practicing in the Pacific Northwest area for about 23 years now. We've had him here at Aurora Lasik. This is our, I believe it's 8th year that Aurora Lasik has been in the Hawks Prairie area. We have a couple of different procedures here to help get you out of your glasses. We have 5 actually. We offer LASIK, which a lot of people already know about. PRK, pretty similar procedure to LASIK. It's just been around for a little bit longer. We offer the EVO ICL procedure. This one's not one of the more well-known procedures, but it is great. We also have refractive lens exchange, or RLE. That one's kind of on the rise in popularity. And then we also have a laser floater treatment. Now, to better determine which one of these 5 procedures will help get you out of glasses, we'll just have to have you come on in for a comprehensive evaluation. At that time, you'll get a whole bunch of scans and measurements, and the doctor will go over that with you to discuss which one of those would be the best option. And then you'll meet with either myself or our other patient counselor, Shantira, where we'll go a little bit more in depth on these procedures, kind of what to expect, everything else about it. A lot of people want to know the cost on these procedures. Now, they do vary, and I typically don't go over the prices before we discuss what's going to be the best option for you, just because I don't want someone to get stuck on that. Now, we do have different prices for each procedure, but we accept any major credit or debit card, HSAs, FSAs, anything like that. We can offer an additional discount for check, cashier's check, money order, anything like that. And we also do offer financing through a company called Alphion. And with LASIK, they have payment options for as low as $99 a month, which makes it pretty manageable, just considering the cost of contacts and glasses that you end up spending over the years. Why pick Aurora Lasik? Now, Aurora Lasik, I mean, I'm pretty fond of it, but that's a given there. You can go ahead and check out our Google reviews, and we've got some pretty high reviews here, but we kind of pride ourselves on our moments of magic with our patients. Every single one of our employees here treats you as a person and just not another number on a page. We remember all these very little things about you, and sometimes we'll even get you a little gift related to the things that we remembered about you. So that's just kind of what sets us apart, along with Dr. Rudd and our amazing patients and the results that they see. So feel free to check those out. Ask anyone if they've heard about us, if they've been patients with us before. It's always great to hear. Also, we're right by a crumble cookie, so that's really fun. Come get a consultation, have your surgery, grab some cookies for the way home. To schedule your appointment, you just feel free to give us a call. Have our phone number here on the screen, 360-459-5274. And if you mention that you heard from me, Leah, at this wellness fair breakout session, we'll actually waive that $100 consultation reservation fee. So typically that's what it is. But yeah, just mention that and we'll waive that fee for you. You can also go online and browse our schedule to see what would work best for you. At that point, it would be a little harder to waive that fee, but I will take it off of your surgery price. So that way you still got that discount. Now, are there any questions? Does anyone have any questions for me about what we went over? I know I went pretty quick through things, but I am very happy to elaborate.
My question would be like, what would you think would, or I guess from your experience, what's the most common one of those, you said 5 procedures that people are usually doing?
So everyone comes in for LASIK. That's just the most well-known procedure. They know I want to get out of my glasses. I want to get out of my contacts. I know that is an option. Now, it's a little different, kind of depending on what your eyes need. Now, if you are starting to notice that you need reading glasses and you're maybe in your 40s or 50s, we look at something more called refractive lens exchange, which is essentially like a cataract procedure, but that kind of gives you the best of all worlds. You can see your distance, you can see your near, you can see kind of the mid ground. With LASIK, that fits the vast majority of our patients, ranging from ages 18 to beyond, and that corrects for your distance. So it just kind of depends on what's going on with your eyes, on what's going to be the best procedure for you. But everyone does come in for LASIK. Just that's what we know.
It's in your name.
Yeah. Awesome. Good question. Thank you. I see a hand there. Chris, what's your question?
So I was kind of curious. I've heard in the past that there's different levels of LASIK, and it is determined by what's going on with your eyes. And you're supposed to set a goal for what it is you want to achieve by the surgery. So I guess I need some clarity of what that means. Does it mean that if you have astigmatism, there's one surgery for that. If you have near vision issues, there's one surgery for that. And if you have distance issues, there's a separate surgery for that, or there's one for all three. Can you break that down for me, please?
Yeah, good question. So sometimes we do something called blended vision or monovision to kind of give you the best of both worlds, where we would correct one eye for distance and we would kind of undercorrect another eye for near. That way it gives you that mid ground. Now, a lot of patients can adapt to that, but for some patients, having one eye specifically for distance and one eye for near, it's a little wonky, a little bit disorienting. Now, we have done contact trials to see if that's something that works for you, but a lot of people are able to compensate for that. So that's kind of what we mean by having a different treatment. It's the same procedure. It's just deciding on how much to correct. Now, a lot of our patients, we are doing distance vision correction, which we correct for all of your distance. It's just those special cases where if you notice that you need reading glasses, but you're not quite ready for refractive lens exchange, that's when we can start having that discussion for different levels of correction per eye kind of thing. Did that help?
Yeah, it did. Thank you. Additional question. If
Mhm.
if you only want to be corrected for, let's say, astigmatism and not the distance, is that something that can be done?
That's a good question. That kind of gets a lot of it. So, LASIK can correct for astigmatism. That's an interesting one. That's a good question for Dr. Rudd. Typically, he's the one that that gives you your goal. Now, we have corrected patients just for astigmatism because that's usually, if they have just astigmatism correction, that's what it is. Now, I know that our director actually had LASIK for astigmatism correction, and I believe she's in here. Do you want to chime in on that one, Nicole?
Yeah, for sure. Hi, guys. Can you hear me okay? All right.
Yep, thank you.
Perfect. Yeah, that's a great question, Chris. And yes, like Leah mentioned, I had LASIK done. I was mainly all astigmatism. So with almost all of the procedures that we offer here, we can help correct whether you have nearsightedness, farsightedness, and or astigmatism, like you mentioned. Everyone's level of prescription is a little bit different. So that may play a role in which procedure that we recommend for you, because some are more effective at correcting certain things than others. But we do have an option, like Leah said, almost for everybody, depending on what your prescription is, even if it is just astigmatism.
Awesome, thank you. Are there any other questions, or is that a good answer for you, Chris?
Yes, thank you.
Wonderful.
What's the typical recovery time after a surgery?
Good question. Each procedure has its own recovery time. Now, with LASIK, it's a lot of our patients, vast majority, feel very comfortable to go back to work the very next day, driving themselves, everything like that. The EVO ICL procedure, we also have patients feeling very comfortable very next day. Refractive lens exchange, we're currently doing one eye on one Wednesday, just because that's our surgery days, and the other eye the very next Wednesday. Now, even only having one eye done, vast majority of our patients feel very comfortable to go back to work the very next day. There is a little bit of an imbalance there, but you can pop a contact lens in that other eye in the meantime. PRK is our only procedure that has a little bit more of an extended healing time. Good question. Any other questions? I love them. Yes, Chris.
What kind of adverse issues are possible? Like, I know with the old-fashioned stuff, the radiokeratotomy at night, if you're driving a headlight coming the other way, you'd see star patterns and stuff. Is there any issues like that with the new procedures?
Good question. So it kind of depends on the procedure we're talking about. Now, with hold on, I'm forming the words in my head. Nighttime driving, still, you may have some streaks or little halos around lights at night, but a lot of our patients find after a period of neuroadaptation that they don't really notice that anymore. It's not the same as like with the RK that you're mentioning, because the procedure, it's come so far. Nighttime driving, I haven't heard issues other than occasional halos, occasional streaks around lights at night. Vast majority of our patients feel more comfortable to drive at night once everything's all healed and said and done. Aaron.
What were the 5 procedures again? I'm thinking like when you said it was a newer one or something like that. Was it the third one?
Good question. Okay, so we have LASIK, we have PRK, EVO ICL. That one's one that people haven't really heard about. The refractive lens exchange, and a laser floater treatment.
So the one people haven't really heard about, what is that?
Good one. So I have right behind me, there's Joe Jonas. I don't know if anyone else is a Jonas Brother fan. I'm a little nuts about him. This procedure is something that he had. It's essentially where we implant kind of like a contact lens inside of your eye to correct your vision. Now that has a couple of bonuses there. We're not touching that front surface of your eye, so nothing has changed. If for some reason down the road your prescription has changed a ton, you don't like it, there's new technology, this is the only procedure that is removable by your doctor. It's really cool. It has UV protection in it, so that also helps protect your natural lens from the elements. We had a couple of our employees actually have this done very recently. They were at higher levels of correction and they had thinner corneas. So that made it hard to do like LASIK or PRK. So with the higher levels of correction, thin corneas, we typically look at the EVO ICL.
And what about the floater laser or floater laser? What is that?
Yeah. So laser floater treatment, if you've got those pesky little things that float around in your eye and are blocking your field of vision, that is something that we may be able to take care of for you. At that consultation, we'll dilate your eyes, take a look back there. If that floater is the right type of floater, it's large, it's in your middle field of vision, it's in a good position. We use a little laser to kind of break that apart, to zap it out, and then your eyes just kind of naturally absorb a lot of it. So we break it up and get it out of your field of vision.
Mhm.
Good question.
All right, so we're out of time right now. Thank you so much, Leah, for coming and answering our questions and telling us a little bit more about all these different procedures. Thank you, everybody who came. The next breakout session is at 12 o'clock, and that is Changing the Narrative, Unlearning Limited Beliefs. This video will also be posted on our wellness page, so you can go back and watch it again. So thank you very much.
Thank you.